Bismillahirrahmanirrahim. Assalamu alaikum. A 53-year-old woman, gravida 2, para 2, come to the office due to right-sided pelvic pain that had worsened over the past 3 months. She has experienced bloating and hot flashes since her last menstrual period a year ago. The patient has recently become sexually active with a new partner and is not using condoms. She was diagnosed and treated for chlamydia at her 40s. She has no other medical problems and had a bilateral tubular ligation at age 35 after cesarean delivery of her second child. The patient smokes 10 cigarettes daily and drink alcohol socially. Her temperature 36, blood pressure is 110/70, leukocyte count at 8,200, beta HCG is undetectable. Pelvic ultrasonography show a 7 centimeter right ovarian mass with solid components, thick septation, and a moderate amount of peritoneal fluid. Which of the following is the most likely explanation of these findings? So this patient is 53-year-old woman. She came to the office due to right-sided pelvic pain that had worsened over the past 3 months. On pelvic ultrasound, which shows that there is a 7 centimeter right ovarian mass with solid components, thick septation, and a moderate amount of peritoneal fluid. So based on these hints, the diagnosis of this question is epithelial ovarian carcinoma. And here the correct option is choice A, abnormal proliferation of tubal epithelium. Epithelial ovarian carcinoma refer to malignancy involving the ovary, fallopian tube, and peritoneum. Ultrasound is the first line imaging modality to investigate this patient finding of a large ovarian mass with thick septation, solid component, and peritoneal free fluid are concerning of malignancy rather than a benign or infectious etiology. The presence of peritoneal fluid in a postmenopausal woman is pathologic and is the origin of the typical symptom of bloating, pain, early satiety, anorexia, and abdominal distension seen in ovarian cancer. Choice B, ascending infection from the cervix. So ascending infection from the cervix causes pelvic inflammatory diseases. Choice C, ectopic implantation of endometrial glands. So ectopic implantation of endometrial glands are endometriomas, which is most common in premenopausal women. Choice D, excessive growth of well-differentiated ectodermal cell. So excessive growth of well-differentiated ectodermal cells are also called dermoid cysts, which are benign ovarian tumor that are solid component but do not exhibit multiple septation or causes ascites. Choice C, obstruction from fluid accumulation in the fallopian tube. So a hydrocephalus is caused by fluid accumulation in a fallopian tube due to blockage by either adhesion, pelvic inflammatory disease, or surgery, bilateral tubal ligation.